Hello, I'm Wendy Wilson, and I'd like to welcome you to another edition of Realizing Potential. Today, I have with me, and still in virtual format, is no stranger to the community, specifically as it relates to the arts. She's so multifaceted, so multi-talented, and one of our many treasures here at Albany State University. She is none other than Dr. Elizabeth Delancy. Hello, how are you?
I'm well. Thank you for having me back.
Oh, it's always a pleasure. You always have an open and standing invitation to join whenever you'd like, because you always bring such great things to the viewing audience and the listeners. Please extend, and I've had a chance to say this to him publicly, but I had the pleasure, and our producer, Connie Williams, also as well. It was a wonderful evening or afternoon where we all went to just experience the amazing production of The Color Purple. And you were instrumental in that very recently. And so hats off to you and Mr. Wilson. It was an outstanding production. And it was it left me speechless. I really thought that I was in a major city experiencing high caliber performers, and they were students of Albany State University, sprinkled with some faculty and staff. So thank you again. I know that was a labor of love. And I'm sure, depending upon the day, emphasis on love and emphasis on labor. But I don't, yeah,
Absolutely.
yeah, you came to promote that. And so it was just absolutely outstanding. So
Thank
congratulations.
you.
Um,
Thank you. Yeah, our students, they really did an
yeah,
outstanding job and exhibited so much maturity that, yeah, I
absolutely.
would agree that that was something that we could have rivaled, what you would have
Without
seen
a
in
doubt.
a larger city. Absolutely. I was so
Very,
very proud.
very, very well seasoned, just magnificent presence. I was in awe in a very uh pleasing way. So just honored to be a member of Albany State University, and I stay in my lane in terms of talents. And I think I shared with you last time, you and Mr. Wilson, the last time I was on a stage in that capacity, I was in high school. So that was many, many moons ago, but it was a wonderful experience. And so that was on top of your many other activities that you engage in here at Albany State University in terms of building and developing our students. But you are
Thank
also
you.
very active in the community, and I know that's why you're here today. Tell us
Yes.
about what we can expect and how we can support, and then the benefits of it is most important.
Okay, well, we've been working in some capacity or another at Albany State, really trying to fight COVID-19. And so my engagement with this initially was with the Quash COVID campaign in 21. And then again in 2022, with my colleague, Boomy Anderson, through her nonprofit organization, they rebooted Quash COVID and called it 2.0. And now, with the Health Literacy for Albany project, which actually has been going on now for like a year or two. And we're really excited because we have engaged with community partners. This is a grant that was awarded the city of Albany by the Health and Human Services and the Office of Minority Health. And they chose us based on the fact that we were a hotspot in 2020. And there are other recipients like Tuskegee, Alabama, the city, and others that are like Morehouse School of Medicine, I believe they're recipients. So we're in good company. And so what we've been able to do is partner with community-based organizations, community-serving organizations to continue our work. But Albany State's role is really to administer the grant for the city. And our community members in Albany have been doing great work. They've rolled up their sleeves. They have been instrumental in organizing vaccination clinics on site, in addition to like COVID-19 education, myth busting concerning the virus and vaccinations. All of these things have been happening. And then also talking about health in general, because we know something that we learned early with COVID-19 was that the people that were hardest impact were those who had comorbidities. And also there are people who didn't realize they had existing conditions, and COVID-19 brought that to the forefront. So our community partners, grant recipients, we had 2 cycles of proposals that we received, and recipients are now actually grantees um, shared what they wanted to do and how they believe they could impact their communities in 3 specific zip codes. That's 31701, 31705, and then some parts of 31707. And so they are doing work in these communities and these neighborhoods, and they are trusted voices because people know them. And it's really been an exciting and meaningful time.
Excellent. Well, there are so many points that I want us to highlight. Well, let's kind of work backwards. And you said those trusted voices. That is so important, particularly when society is dealing with so many different social ills. And what we know to be factual are those communities. Some communities feel those the circumstances related to those ills much harder than others. And that was certainly showcased once again when COVID hit, and how it impacted particularly communities of color or impoverished communities who were already challenged, as you said, with individuals, constituents that had high comorbidity rates, lacked access to resources and the healthcare of all things. And so the condition was then exacerbated because of the lack of, coupled with the point that you just made. So then how do we educate and inform and provide these individuals with these services to improve their plight or their condition? And then we are taken aback, communities, when we discover that there is some reservation or some resistance to that. Well, the trust factor then comes to the forefront. I don't see you until something major occurs, and then I respond to you with some concern or some reservation or trepidation, and probably all 3, because is there really some intended good coming my way? And that is a lot for communities to grapple with. And some just individuals make the decision, I won't partake, I won't indulge, which we saw, I don't want the vaccine.
Right.
I'm going to ignore the science. And so what you are sharing, and we do know that it has been successful, is that if you then attach that important message, or if it is then expressed by trusted voices, then it becomes more palatable, and then people receive it. And so you all were very, I know, intentional with the design and execution and making sure that you partner with individuals that can relay the message and it be received, because I trust what you have to say, because you've demonstrated that you are trustworthy.
Absolutely. And that's so key, because if we look at the social and political climate during which the vaccine was introduced, I have to admit, while I am fully vaxxed and boosted, I don't know how many times, I have the latest, I'm waiting for when I can go again.
Right.
I was one that was apprehensive. In fact, I wasn't going to partake because the politics were just so ingrained, and I certainly did not trust who was in the White House. And then a trusted voice to me, Dr. John Williams, who is the department chair of biological and health sciences. I can't keep all of the names straight.
I know, yeah. Yeah.
But he's a good friend.
John Williams. Yes.
Yes. And he shared with me, he explained to me the science behind it. Mm-hmm. He explained to me the research, that this is something that didn't just happen overnight, despite the how it was given a name by who was it, 45, like I can't remember
Yeah.
some whatever nomenclature was used. And because that was misleading, because if you looked at that and you thought, oh, it was something that was created rapidly, that actually wasn't accurate, because they've been studying coronaviruses for a very long time. And so and things, research is better today than it was even 5 years ago. We
Absolutely.
can come to solutions and get results a lot faster because the technology is there. So yes, things are faster, but it wasn't overnight. This is something that has been researched and tested and things like that. It may have been launched a little bit earlier and a lot broader than it needed to be, had the initial response to the outbreak been different. But here's where we are. And so, but I admit I was one that was, I had trepidation. But when my trusted voice, Dr. Williams, explained XYZ, and this is why I'm going to get it. And so that was the key, when he said he's going to get it. And I trust who he is as a professor, as a scientist, and as my friend. And I was like, oh, okay, then I will partake. And now I've been beating the drum, because I had positive results, and I, made sure that my family and anybody in my bubble, that they knew about it. But, that's the thing, who are our trusted voices? So our churches, sometimes it's medical professionals, but, as African Americans, we do have a lot of medical hurt history.
Sure.
Even today, women, disproportionately Black women are still dying in childbirth. Like, we live in a third world country.
Right.
There's still beliefs that we have higher tolerances of pain, all of these things. And so there is sometimes medical mistrust. But what we have tried to do with the Health Literacy for Albany project was link the community, not only with the churches and other community-based organizations and community-serving organizations, but also with trusted medical professionals. Not to say that you can trust everybody, but here are some people that we know understand what you're going through, and we know that they will hear you, and we know that they're going to explain things in a way that you can understand, and that they will allow you to ask questions, and they will tarry with you. Forgive the church lingo, but they will work with you until you do have a higher understanding or a greater level of health literacy concerning your own well-being. And so that has been part of, well, really a major part of what we've been doing, connecting people to resources and connecting organizations with financial resources so that they can branch out. And so at the end, when we collect all of the studies and the feedback, I am confident that Albany's health literacy will have increased, because there are a lot of people who are, speaking truth and dismantling disinformation, misinformation. And, and it really is, it's a rapid fire endeavor, because, wow, it was just really hard to keep up with initially. I mean, and when you had the one in the White House talking about inserting UV light up your derriere and drinking Clorox or some kind of disinfectant, or eating, dog and worm medicine, it was a lot to really combat. And then, of course, the people in our community really step back, and it's like, oh, well, this is a circus, and I don't have to be a part of this circus. So and I understand that. So peeling away all of that chaos has been something that we've really been working on, and we're going to continue to do that, because we have a symposium coming up on June 3rd, Saturday, June 3rd. That's the first Saturday of the month, and we are going to get a chance to look at where we started in 2020, as a hotspot that took some dear friends and family. And then, where we are right now, I mean, we know that today is the day, or this month is the month that COVID-19 is officially no longer a medical health crisis or emergency. Not to say that it no longer exists,
Right.
but it's just, we're not at that crisis level that we were. And so we still do have to take measures and, stay healthy and take precautions, masking. I'm a masker. I mask most of the time, but, and do other things, hand sanitizing is important. Social distancing, particularly when you're in an environment where you don't know people, masking when you're in an enclosed environment and you're around people you don't know and you don't share households with, things like this that are still important. Because just recently I was reading an article about the CDC. They had their annual, their annual conference. And at that conference, 35 people contracted COVID-19 because they weren't following their own guidance. And so that's pretty insane, but that, kind of underscores that, we're not through the woods. So we still do need to be careful, particularly if you have those pre-existing conditions or you have compromised immune system. And especially if you know that you're not able to take the vaccine, or if you don't want to take the vaccine, because, if you don't want to, for whatever reason, because it's still early. And, if you're concerned about reproductive harm and you don't believe that there's been enough research with that, well, there are other things you can do, like making sure you sanitize your hands, you wear your mask, and, make wise choices. But, we're going to talk about that, what we're doing now. And then we're going to look at what will the future be? Because we know that COVID-19 is not going to go anywhere. And so, at some point it's going to become like our flu, which was the Spanish flu, which was the last huge pandemic that we had in this country, where everybody had to do the same things like masking and all of that stuff. So that was a major health crisis. And so here we are in ours. So what does that look like moving forward? And when does it get to the point where all of us can feel comfortable wearing our masks and, all of that, like kind of business as usual, although some people have moved back, depending on their comfort level, have transitioned, But, and so we're going to look at all those things. We're going to have medical experts from the CDC, the Department of Health, locally and for our region. And, Wendy, we talk about this all the time. Mental wellness is key. We look at, with our students and what isolation has done. Well, gosh, to us too,
yeah.
and to, my God, baby boomers. I know I think about my dad, he relied on me for transportation. And so when the world shut down, that meant that he didn't get to go out and go to church, and things like that. And frankly, I was terrible company for him. So, it's just like, oh God, I feel really bad. I just don't know what to do about it. But, it really hit us all hard. And we know that the young ones are really, they seem to struggle socially anyway, because they have these things called handheld devices. So, yes, me too. But they're already challenged, because I don't, and so having to shut down, that really did something. And so, but they're not the only ones. And so, and people who were used to, I don't know, going to group for, addiction treatment, therapy, group therapies, all of that stopped. And, and so we had to pivot and then shift everything to virtual. And there are just some of us that just do better face to face, period. And, and then there are some of us that learned that a lot of things can be handled virtually or with an email.
Yeah.
But, hey, or a text.
Oh,
but, but for some, not so much. And I know that, the Gen Xers, I think we fared really well because we were the latchkey kids, so we knew how to entertain ourselves. But, some of the people on the other sides of where we are did not so much. And so, we're going to talk about health, mental wellness, and what does that look like? How do you connect to those resources? Who are the people that will listen to you? And then the other thing is COVID, long COVID. I am a part of a group, a long COVID group on Facebook. They invited me in. I don't suffer from long COVID, but I just was curious to know what they were dealing with. And I mean, it's just heartbreaking. Ear ringing, heart trouble, brain fog, respiratory issues. and a lot of times when people are dealing with this and it seems unending, they feel that the only relief is suicide. And so there have been suicides that have resulted from long COVID. So that's something we definitely want to prevent. And we want to encourage people that there are doctors that understand that long COVID is real and that a lot of the symptoms are very similar to chronic fatigue syndrome. And so we're hoping that those scientists will start to cheat off of each other's papers, as Stacey Abrams likes to say, and really work together to get people the help they need. But we have scientists and practitioners right here, like, oh my God, Dr. Marla, Eddie's sister. My God.
Black.
Yes.
Yes.
Yes. Thank you.
You're welcome. No worries.
Oh my God.
No worries.
Yes, but she's a neurologist, and she has long COVID patients, and she has really great strategies to help them cope, particularly with like mental fog. And then we have practitioners in our community like Tracy Knighton. I don't believe she's on program, but she's one that was referenced, and that we hoped that maybe we could pull on board because she has patients dealing with that, I believe. But and then grief. People have lost people, and holidays don't look the same anymore. Day-to-day life doesn't look the same anymore because of the loss that we experienced because of COVID.
So as you were going to the next, I was, almost just. I don't want to use the word paralyzed, but it just really was like a bell ringing in my head, how nuanced the complexities of those 2 years, of COVID itself. And the years down the road, discovering just the impact of that 2-year period and the toll that it took. I think will be, the educational system, as much as our educators try to do their best in that moment, the immediate shift. And as you said, everyone doesn't do well in a virtual format, but you did not have a choice. So for many students, whether they were in post-secondary or whether they were in the K through 12 system, to be thrusted into that environment. So really 2 years of academic development and attainment in many cases was absolutely lost.
Absolutely.
Yeah. Coupled with,
Absolutely.
I would love to read, or if someone's doing a study on how the different, you mentioned Gen Z, Gen X, all of this, how those populations, those different demographics, how they fared in comparison to one another during that 2 year period. Yeah, because you're absolutely. I just had a conversation with my son the other day, and we were discussing something else, but I said, I understand that your last 2 years of high school was just totally non-existent. You were thrust into this unknown world. And so where you're, those are supposed to be the fun years. That was stricken, that was taken away from you. Right. And so all of those things where people have either they're still processing or have yet to process the impact that it had on them. You're right, your mental health and wellness, what does that still look like? Because we were closed in for 2 years, for the most part, very restricted. Now you're saying, some people are like, yay, we're back in the world. And some people are like, what? You want me to go where? We have a lot of students. And this is across, not just USG, but across the country, where you hear colleagues say, we have students who come to the door and they're like, I can't do it. You're like, you can't come into the classroom, but they're struck with anxiety. I don't know what it is to, you want me to mingle? You want me to interact? And and that's compounded with this has been their interaction the majority of their lives. So it is absolutely so much. I don't want to also miss, and I know we need to get ready to wrap up because I want you to share those dates again and share who's invited. But you also reminded me of the importance of representation, which also factors into that trust factor. And me here listening, and then taking that information and then determining if it's going to serve me, my home, my community, the list goes on. Particularly
Right.
if there's been a history of reasons for distrust. So I was reminded when you
Absolutely.
said, hey, and you are the Dr. Elizabeth Delancy, and you know how to access resources. You are a walking resource yourself, but you were very transparent and said, I had my concerns about this vaccine, and what would be the long or short term implications or ramifications of taking this vaccine. We know what it was designed to, but you had a resource that you knew that you could
Right.
that you could access. And so here you have Dr. John Williams, who you said, "Hey, John, look, tell me what you think," and he educated you. Well,
That's
everybody
right.
doesn't have access, unfortunately,
Right.
to a Dr. Elizabeth Delancy, to a Dr. John Williams, to a Dr. Wendy Wilson, to a Connie Williams, to a Dr. Marion Ross Frederick. I mean, this where we normalize this, so many people who look like you and I still don't know or have access to those individuals. And so
That's
they
right.
rely on what I read on Instagram
Oh,
or
yeah.
and so that's where the distrust and the misinformation comes into play. I share all of that to say representation is key. So
That's right.
with the decision of this health literacy, those designers and planners of that, where you are then educating those trusted individuals to go out into the community and share and inform. You and I could go on, but there's an opportunity for us to go on. You said in June, and
Yes.
here the experiences, the experts come. Give us the date, the location. Is there a registration process that they need to go through?
Yes. So the date again is Saturday, June 3rd, and the time is from 10 a.m. to 2 p.m. It's going to be on Albany State East Campus, the lower part in the Hartnett Criminal Justice Building. It's in one of the large lecture halls,
Okay.
and I you will have the flyer that you have with the QR code that can be scanned. But if you happen to, any viewers happen not to have a QR code reader, certainly they can call the contact number, and speak to Mrs. Kernice Battle Jones, and she could assist them with registering, because this is it's an event that's free and open to the public, and so we want everybody to come.
Right.
And it's going to be an opportunity also to take advantage of getting vaccines, because free vaccines are ending. And so if you don't have insurance, paying out of pocket may be difficult. And so
Yeah.
this is an opportunity. There are going to be, I think, about 4 different health organizations administering vaccinations. We also will get an opportunity to listen to people who have survived COVID. And some may be suffering from long COVID or not, but they'll talk about their experiences, and, perhaps, what it was like if they had it when they were vaccinated or not, and how scary or whatever, because people have different experiences. I know I had a friend who had it in 2020, and she was afraid to go to sleep. Because breathing was so hard, and that was the alpha variant that took so many of our friends and family in Albany. So and we're going to have a myriad of people, scientists, trusted voices, the people who have been laboring, grassroots organizations are all going to be in one place. And everybody will get a chance to learn about these grantees, these organizations, and what they do in addition to COVID-19 education and debunking of myths and what have you. Because, like, for example, we have Tosh Sevier, I believe is an Albany State University grad who has Albany Cares. They do work all of the time. You have Genesic nonprofit. They specialize in work with sickle cell anemia, and they work and they labor already in these zip codes, where we were hardest hit. So we have churches as well. So there are so many organizations that have already been doing the work, but we may not know about them. And so it's going to be an opportunity to lock eyes and lock arms and exchange information, and then leave at 2 o'clock, but know that we carry that piece of all of them with us, and that knowledge. And because knowledge is not just power, it's health. And if you have health, you have wealth.
I love it. I can't think of a better way to end. And so our producer does a great job. So that information will be in the lower thirds. And then we'll have, this will get regular earrings. And then we'll also have, the flyers that will also be shown on ASU Channel 19. Dr. Elizabeth Delancy, thank you so much for your great body of work, and you keep adding to it. But your commitment, I know none of what you do is easy on most days, but it is your steadfast passion to see others succeed, see them develop, hold us accountable, put the mirror in our faces and say, we can do better because we deserve better, and we all play a role in that. So thank you so much. I look forward to attending this event. Know that you are always, I'm just going to say it, but you already know it, always welcome back on the show to share all of the great things and deeds that you're doing on a daily basis.
Thank you for having me. It's always a pleasure.
My pleasure. My pleasure. Viewers, thank you so much for joining me for this edition of Realizing Potential. I'm Wendy Wilson, and I look forward to seeing you next time.